స్టార్ట్ చేసేయమని చెప్పను. హలో హలో ప్రసాద్ గారు స్టార్ట్ చేయండి. హలో హలో
I'm Dr. Lakshmi Ratna, Senior Consultant at Apollo Cradle Hospital, Jubilee Hills. Today, let us know what is the importance of the vaginal discharges in women. It's a very common subject, but sometimes it's such a nagging problem to disturb the quality of the life of a woman. So one should know when to contact the doctor, when it is abnormal and or when it is normal. We do come across a lot of types of vaginal discharge. When a woman comes and complains that she is having an excess vaginal discharge, because a woman knows that during the middle of her menstrual cycle, she usually feels wetness. That's an indication of ovulation, which is a normal function of a female body, producing a good egg in the middle days of the menstrual cycle. So those who are having irregular menstrual cycles, they can easily identify their dates of ovulation by this increased vaginal discharge, which is of a mucus nature, sticky fluid coming out of the vagina, which is an indication for timely ovulation. Okay. But when a woman complains that there is a copious excess vaginal discharge, so we need to check few things. Whether the woman is having any associated burning pain in the vagina or in her private parts, or is there any bad smell? Apart from this, she can also have pelvic pain, vaginal pain, and lower abdominal pain, which indicates that definitely she is having some kind of a pelvic inflammation, not pelvic infection. That means it's a bit more than the lower reproductive tract infection. It has extended into the upper part of the female reproductive tract. So when a woman complains along with the vaginal discharge, other symptoms, we are a bit more concerned about it, because that will clinch the diagnosis of whether she is having any bacterial infection, fungal infection, viral infection, or any systemic disorders associated with this, or any other growths in her private parts. So these are so many conditions which we have to evaluate step by step. See, suppose it is a colorless, just a watery discharge. It can be a normal vaginal discharge, which usually we do see premenstrually or during sexual intercourse, or some kind of any pathological condition. Hydrosalpin is what we call, that is fluid retained in the fallopian tubes, which comes intermittently out of the vagina as a clear fluid. So this is one thing. Second thing, Suppose she complains of yellowish discharge, usually it does indicate bacterial infection or any sexually transmitted disease like gonococcal infections. Suppose it is like a curdy discharge, which is the hallmark for a fungal infection, that is candidiasis. Okay, yeast infection commonly said is, which is very common during pregnancy and diabetes. So you have to evaluate whether that particular lady is going to have a full-blown diabetes later in her life. Suppose there is a vaginal discharge which is contaminated or which is little brownish red or pinkish red. It can be due to irregular hormonal imbalance, or there can be certain growths, what we call vaginal growths, or there can be polyps in the cervix which can give this kind of a blood stained discharge. So the doctor usually examines you um, with a speculum examination and a bimanual examination, and also subject you for an ultrasound examination to know whether there are any associated pelvic pathology. Okay. Now, coming to the pap smear part of it. Pap smear is a simple screening test for all the women. In fact, age is not the concern, but the first intercourse is the concern. If they are having any active sexual life, even though it's not the marriage, they have to undergo this pap smear test at least every 3 years to check whether there are any changes in their cervices which can lead to cervical cancers later, much, much later in their life. The beauty of the pap smear is if we can diagnose any kind of a minor major abnormalities and the pap smear report, we can deal with that condition easily in a very, very minor way, and then we can retain the uterus. There is no need of any major surgeries like hysterectomies. The very simple measures which can take away that problematic area on the cervix. So the pap smear we compulsorily do after each delivery, because that is the time when they come for a checkup. Even other times, even if they miss after delivery, we routinely call them after 3 months of their deliveries. So we start from the young age and put in their mind that every 3 years they have to come, whether deliver or not, whatever it is, they have to come every 3 years and go for this pap smear test. Mind you, this thing should go on till 60 years of age, every 3 years. Even though the woman doesn't have any symptoms, she is hale and hearty, but still we do this pap smear test as a screening test. Of late, more than the pap smear, we have the technology developed to check actually the virus, the human papilloma virus, what we call HPV virus, which can cause cervical cancer. The particular strains, there are hundreds of strains of the HPV virus, but particular virus, few strains of viruses that are more notorious for causing the cervical cancers. So we have a specific test. We do the typing of this HPV virus, and we can know clearly whether they're having that and which is more, who are more prone for cervical cancer. HPV testing. Now, coming back to this uh, vaginal discharge, there are conditions where the vagina is totally dry during menopause or during lactation, breastfeeding time, or following some chemotherapy. So, what happens here is usually vagina doesn't have any kind of glands to secrete any kind of liquids. But this is what we call transudation. This is a mere um, fluid just coming from the transudation, means just spreads from the cells into the vaginal cavity. and keeps it moist, keeps it healthy, and drives away the dead cells. This is a sort of a protective mechanism, which is a natural innate mechanism in our body. So I don't think any woman should go on douching her vagina or inserting something in the vagina. We have natural mechanisms which keeps the vagina healthy until unless of course there is a kind of an infection or any growth or any polyps inside. That's a different issue where there will be a constant production of these secretions. Until unless that particular part is evaluated and treated, they will have this kind of a discharge. So, whenever there is a possibility of multiple sexual partners, the more important is this HPV infections and gonococcal infections. So, we do take a vaginal swab test, which we send to the laboratory for the culture, so that we know particularly which particular bacteria are infecting. So we can give them a suitable antibiotic rather than just hitting in the dark with any kind of an antibiotic. Second thing, viral cultures are very difficult, but we do have the HPV testing, as I just told about the human papillomavirus. But don't get alarmed with human papillomavirus because our body has got a lot of fighting mechanism or immunity, which will take away most of the infections, including HPV infection. Suppose 100 women get the infection, 80% will be naturally cured. Only 20% progress to the next steps, next stages. So that you have to meet the doctor, have a sort of a discussion. So if you are very young, nobody will suggest you the hysterectomy. We have other kind of treatment methodologies, and we will definitely try to save the uterus in the younger age until unless it is really, really demanded that hysterectomy is needed. So coming back to starting from a normal physiological excess vaginal discharge which happens during sexual arousal to the menopause stage where the hormones are completely dry because hormones are low, so the vagina is completely dry, and the dry vaginal skin gets infected. They'll have got a discharge with the infection, a lot of irritation. So, any stage of the woman's life, starting from the reproductive stage and pregnancy, lactation, the menopause, these kind of secretions or vaginal discharge are different types, different of reasons, and the treatments will be differed. So now somebody wants to know about more about the discharge. We have got this particular trichomonas vaginal infection, which is usually sexually transmitted. Very, very irritating, very frothy discharge it comes. And this is contaminated, like it communicates with their sexual partners. So, particular woman who is having this kind of frothy discharge with a lot of irritation and itching sensation, they must get their partners also to the doctor because this particular infection has to be treated both in the husband or the partner and the wife also, because otherwise there is no point just treating the woman and again she'll get infected and come back to it. It will be a recurrent infection. And sometimes there will be just the obesity. When we talk of the obesity, because overweight and obese people, the aeration or the ventilation of the private parts of a female body, the groin regions, they are ill ventilated. The mere obesity itself, because of the ill ventilation, there is a lot of sweating. And in the sweat, because our body is always covered with a lot of bacteria, it's common for everyone. So in the sweat, this kind of bacteria, they flourish, they overgrow and cause a secondary infection and gives a very horrible bad smell. So here, more than the radical treatment, patient has to cut down her weight, and go for regular exercises. And one most important point is to wear the inners or the underwear as cotton ones. And once they are wet, they have to change it. They cannot keep the wet or sodden underwears for a longer time because it will favor the infection, it will aggravate the infection, so they need to change. And always go for the cotton underwear, that's most important. And preferably at home, I think during the nights, it's better that they don't wear the underwears. It gives a little bit ventilation to the vagina. Now, vagina is an organ where there is no closure naturally. It is actually an open organ. Unlike uterus, which has got a lot of muscle, and then it has got a cervix, which is always closed and which gives a natural barrier for the infection to enter into the uterus. So, to some extent, in nulli gravida, that is when they have not, they are not pregnant, they have not given birth to a baby. Usually, this is a closed organ, cervix. Only it allows the menstrual fluid to go out, but it gives a kind of a secretions and it kind of a mechanical barrier for the infection to enter. But in the vagina, it is not like that. Any kind of a foreign body inserted or constantly, there are, you have to sometimes children constantly start scratching in that area. The parent, the mother should observe this thing. There can be kind of a hormonal deficiency at this age, young tender age, like 5 to 8 years, like that. That time, the hormones will be low in there before they start the prepubertal growth. And this low hormone level causes the vagina to be dry, and that attracts infection, that causes a lot of itching. So knowingly or unknowingly, the girl will be going on scratching. The scratching will irritate the skin, vaginal skin, and then that attracts the infection. Then they start the secondary bacterial infections, and then the process continues like a vicious circle. So one has to be very careful observing their young girls, that if they are constantly scratching the private parts, they have to take a gynecologist's opinion. Let the doctor examine the child. There can be sometimes foreign body insertions which we come across because out of inquisity, curiosity, we have seen that children do keep some kind of small sticks or some objects inside and which are forgotten, and that causes a lot of infection inside. And also, having said all these things, common things, there are rare things like tumors. In the vagina, there can be cancers, which is usually called sarcomas, and the child may actually present to the doctor with a complaint of sudden bleeding, sudden discharge, because there may not be any other symptoms before that. And then when we examine, there will be a growth in the vagina, which can be bad growth. So a simple discharge can become very complicated issue later on. So one should not take lightly the vaginal discharge. They must go to their doctor, sort out whether it is a physiological or a normal or is a pathological. If pathology means whether it is involving the lower part of the genital tract or whether it is involving the upper part of the genital tract, especially the fallopian tubes, especially in the during reproductive age of the woman. When they are trying for the baby, the fallopian tubes are very important. I know, of course, nowadays there is a IVF and all the technologies where they don't require the fallopian tube, but one wants to conceive naturally. The fallopian tubes are very important for the transfer of the gametes, the sperm and the egg. So the tubes should be all right if they want to conceive naturally. And any kind of infection, all the sexually transmitted infections or the vaginal infections can spread upwards, go into the uterus, cause an endometritis problems and then enter into the fallopian tube, causing salpingitis, which can later on lead to blockage of the fallopian tubes. If the tubes are blocked, it's very difficult to conceive naturally. And second most important dangerous thing is if the tubes are blocked, as the tubes are infected, when they get pregnant, the pregnancy can be in the fallopian tube, which we call medically as an ectopic pregnancy or a tubal pregnancy, because this is not a normal site for the pregnancy to grow. Fallopian tubes are very delicate structures. They cannot withstand the continuation of pregnancy in them, and ultimately they rupture, they give away, and then the patient will land into severe shock. And there will be an emergency surgery to save the lady. So, one small infection coming from the vagina, spreading with the negligence, not going for a proper treatment or checkups, it can spread and then involve the fallopian tube, involve the lady's life also. So, one should be careful with the vaginal discharges, which are normal, which are abnormal. That will be told by the doctor who examines her. If there are any doubts, the questions. Okay. So we will end with this session of the vaginal discharge. One more thing, as I said, vaginal swabs, because this is an important thing. We have to tackle the infection by giving a proper, accurate, suitable, sensitive antibiotic, which will be known by this culture sensitivity test of the secretions. We take that secretions, vaginal secretions, by a swab and then give it in the microbiology lab for it to grow the bacteria. And then we get to know that sometimes there will be a mixed infection, so a prolonged course of antibiotics. And then we repeat after the antibiotics to recheck that whether it is completely cured or not. And mind you, if it is in the reproductive life, please check your partners also. For them, it is a urine infection. Usually, they do not exhibit any symptoms. But if you are having a active sexual life and you are having a kind of a vaginal infection, it's always better to treat the partner also, so that you will be saved from recurrence of the infections. Okay, thank you.